Welcome, everybody. I'm Maria Marshall. I'm the director of the North Central Regional Center for Rural Development. It is my pleasure to, it's always my pleasure to introduce everybody for the webinars, but this one in particular, because it obviously is dear and near to our heart at the NCR-CRD and our data set. So welcome to the Caregiving Across the Life course in rural and urban households in the North Central region. Our next webinar will be March 6th, and it'll deal with collaborative drought planning using drought scenario exercises. And so we look forward to seeing you at our next webinar as well. I know I always see familiar faces at the different webinars, so it's really great to see that you all are staying with us in our diverse set of topics that we have. But today we're going to talk about caregiving. And so it is my pleasure to introduce our three presenters, Dr. Zuzana Bednarek, Research and Extension Specialist at NCR-CRD. Zuzana conducts applied research in the broad area of rural, social, and economic development. Dr. Shoshana Inwood, Associate Professor of Community, Food, and Economic Development at The Ohio State University. Shoshana is a rural sociologist and co-directs the Center for Community and Working Landscapes at OSU. Integrated research and extension program uses both quantitative and qualitative methods to examine how social factors, including access to affordable quality childcare and health insurance, affect farm and rural community and economic developments. And Dr. Florence Bacot, Associate Professor at Pennsylvania State University. Florence is a rural sociologist whose research and extension program focus on the health, safety, well-being, and economic viability of rural and agricultural populations. And Florence and Shoshana were both fellows of NCR-CRD, working a little over a year on this survey. And so we think their efforts were well made. And with that, I will turn it over to our first speaker.
Well, thank you, Maria, so much. And a big thank you to all of the different team members at NCR-CRD. We so appreciate this opportunity. And a big thank you to all of you for taking some time out of your schedules to join us on this webinar. And we're really excited to share with you what we've been working on for the last year. So what we're going to cover today is a little bit about the purpose and design of the survey. I'm going to go over that. And then Zuzana is going to share the survey methods and also where to find the data. And Florence is going to take us through a highlight of some of the preliminary data findings and to really just give you a little bit of inspiration about how you yourself can go into this data set and use it as well. And we know that science is never created with one individual, but is really a team effort. And we had a really dynamic and exciting and dedicated survey team that helped to design this survey and think very thoughtfully about what the different questions would be. So I'd just like to acknowledge Carrie Henning-Smith from University of Minnesota, Selena Caldera from AARP, Lacey Brown from South Dakota State University, Jennifer Finders from Purdue, and Stephen Cohn from University of Rhode Island. They, in addition to Zuzana and Florence, were really instrumental in helping us design this survey. Okay, so diving right into it. Many of you may have heard of Rosalynn Carter, former First Lady, but also was a real pioneer in thinking about the value and the significance and importance of caregiving. And she passed away this year, well, back in 2023. And one of the famous quotes that she's left us with is, there are only 4 kinds of people in this world: those who've been caregivers, those who are currently caregivers, those who will be caregivers, and those who need caregivers. Caregiving is universal. And caregiving is so important to understand because it affects us in different ways, all of us, and it changes across the life course. Caregiving is complex and multidimensional, and it happens when people are living closer together. It's not only the physical elements of caregiving, but it's also about arranging for transportation, food deliveries, creating medical appointments, and it's also about providing emotional support. It comes in so many different forms, and it creates a lot of energy and time that we devote to caregiving. And also, as human beings, it's so important to our own development and us as members of a community to be cared for. It's also important to acknowledge that caregiving happens across geographies. Caregivers may be residing in the same house with people who they are providing care to. They might live in the same town, or they might be in a different state or even in a different country. And so it becomes really important for us to understand all these different experiences, particularly how it affects the community and economic development of our North Central region. Okay, sorry, I'm moving on a couple screens here. So what's really interesting is that caregiving, right, whether we're talking about caregiving for children, adults, or older adults, appears in both national policy and employer work-family policy level conversations. It's one of those universals. But we rarely actually discuss caregiving in relationship to rural economic development and also community economic development. And it's really important for us to think about these in this larger context of rural and community economic development in the North Central region. One of the things at its most basic level is caregiving really affects an individual's human capital, right? Their capacity to receive education, to work, their skills, talents, and abilities. When we think about it at the youngest ages of children, right, we know those first formative years of what childcare looks like influences brain development, it influences workers far down the line. And in return, on the flip side of that, when we look at in the community and economic development literature, when we look at those institutional theories of labor markets and workforce development, we see how critical caregiving institutions and supports are for the labor market, right? Caregiving, the availability of caregiving enables people to work, right? They can participate in the labor force, which creates more economic growth. It creates a tax base, right? It really affects our communities' ability to afford housing, transportation. All of these things are connected. And at the same time, those who are providing caregiving, especially in the formal sector where they're being paid, are also themselves economic engines and contributing to the larger economic welfare of our communities. So one of the things that we know about caregiving is that it really rose to the level of conversation around caregiving in the United States really grew by leaps and bounds with COVID-19, where universally across the United States and also across the world, people found themselves providing care in ways that they may not have had to previously. And what that did was it exposed some of the fragilities within our caregiving support system. And so, this became a really important issue and one that the NCR-CRD Council of Advisors, Stakeholder Advisor Group really said that this is one that we need to understand. And one of the reasons for that is because when we look at caregiving, right, it's really important for us to understand what are the lived realities of rural and urban residents in the North Central region, right? Because we know that caregiving, when we look at the literature, is a really important component of building stronger, more resilient communities. Bonnie Braun, in some of her research, identified this interplay between ordinary and extraordinary stressors, right, that can affect individuals, families, communities, and whole economies. And in a lot of our current programming, whether it's public or private, we often focus on the supports that are needed in the case of extraordinary stressors, like research and support on climate change, or suicide prevention hotline numbers, right? All of which are very critical, but we also need to understand how these very extraordinary stressors interplay with ordinary stressors, such as caregiving, which in turn actually exacerbate the extraordinary stressors. So these caregiving issues, right, and the cost, availability, quality of caregiving, right, is actually a really fundamental piece of thinking about how do we build more resilient communities. Okay, so the other thing that we're really excited about this data set, right, is that we really recognize that the North Central region is highly heterogeneous, right? There's a lot of different demographics and populations that live within our region. And caregiving is cultural. And so it's really important to understand the differences between rural and urban caregiving experiences, as it is important to understand the experience of different demographic groups, whether they vary by age, sex, race, ethnicity, and citizenship status. And it actually took a really long time for us to develop this data set. And it's actually a very unique data set because our goal was to actually understand who is providing child, adult, and older adult care. This data set actually doesn't exist anywhere. And so we constructed it from different surveys, but really the team coming together and saying, how do we actually capture a much more holistic understanding of how caregiving intersects with community and economic development? And how do we also understand an individual's lived experience with caregiving? And really, we wanted that information to help us and all of you develop evidence-based recommendations that can help support caregiving. And Susanna is going to go into the mechanics of the methodology of the survey, but it's really so that we can have both regional and state level data. And it's really designed to be useful to researchers, extension educators, practitioners, and decision makers so that it can inform larger programs and policies. Our other intent is that this can really be seed data, that the data that you start to explore is in no way going to be comprehensive and give you all of the answers that you're hoping and are maybe hoping to find and are curious about. But our hope is that you can leverage some of the data within this data set, that you can go into further grants and other studies in your particular area and in your particular region. So we're going to go through in this data set and look a little bit more at some of what we found, but very broadly, our data set really covered what are the demographics of caregivers so that we could get a better understanding of who's doing caregiving, also who's being cared for, why people are being cared for, and what that caregiving looks like. We have some really interesting questions in there looking at everything from physical, social, emotional to long haul COVID issues. We also are really interested in understanding how caregiving impacts individuals. How are caregivers perceiving their own social and economic well-being, and also their mental and physical health? And then most importantly, what types of programs and policies would help caregivers so that we could have a better understanding, right, of what's helping caregivers and what are the things that they would like to see. And also some of those hard numbers about what folks are actually spending on caregiving, how it's affecting labor market participation, and having some other really concrete data numbers that we can use to really, again, inform programs and policy and future research moving forward. So at this point, I'm going to turn it, the other part is that actually the Rural Centers for Rural Development have been in conversation about this data set, and we're really excited to announce that the survey is going to be replicated in the Northeast region. And so there'll be an increasing not only the North Central region, but the Northeast region will have comprehensive data for us so that we can compare data sets and understand how these issues are starting to emerge both nationally and regionally. And with that, I'm going to turn it over to Susanna.
Thank you. Thank you, Shoshana, for this great introduction to caregiving and this great words that are a great beginning of the survey, the introduction to the survey methodology. So I will tell you a few words about the way how the data were collected. This caregiving survey was designed as a 15-minute Qualtrics online household survey that covered both rural and urban areas in all 12 North Central regional states. And at the beginning, I need to emphasize that in this survey, we focus not only on caregivers, but also non-caregivers. So we collected data from random respondents and had a screening questions about who is caregiver and who is not, but I will get into it in the following slides. Our survey included a couple of parts. The first part is about or includes quota questions and screening questions, and again I will talk about them in the following slides. As Shoshana mentioned, we have the section that includes questions about household demographics, where we asked all respondents about their characteristics, social and economic characteristics. But of course, the main part of the survey is focused on caregivers. Although the first couple of questions is for non-caregivers, because we, of course, didn't forget about them. So they had separated questions about their life. However, the big part of the survey is is devoted to child caregivers. Then separate section is for adult caregivers, and the final part of the survey includes questions for all caregivers that which are the same for child and or adult caregivers. And I see that I cannot move slides. So Shoshana, please, can you move the slide for me? Thank you. So here are our quota questions, which specify our survey sample. Now it works. The sample specification means that we wanted to reflect as much as possible the demographic characteristics of the people living in North Central region. We decided for 5 quota questions, and we focused on non-family and family households, the share of urban and rural households. We were looking at households by race and ethnicity, gender of the householder, and age distribution of respondents, with special focus on respondents between 45 and 55 years old, because it's the most difficult group to be reached. We implemented this quota on the entire region by state. So we implemented this quota in each state. This is called nested quotas. Despite the characteristics by state can be a little bit different in each state, we make average of these characteristics and made this quota for the entire region. Our screening questions were focused on identifying who is a caregiver. All respondents were asked 2 questions about child caregiving and adult caregiving. So to specify who is a child caregiver, all respondents were asked this question: at any time in the last 12 months, have you provided paid or unpaid care to child or children in your family or household, or someone else's child or children within the last 12 months? Yeah, this is what I said. And it was important, and Shoshana also mentioned that the geographical aspect, that the child or children doesn't or don't necessarily need to live with the caregiver. The similar question was about specifying the adult caregiver, when all respondents were asked whether at any time in the last 12 months they provided paid or unpaid care to an adult family member, household member, or friend to help them take care of themselves. Again, the adult doesn't have to live with the caregiver. And we also suggested options what the caregiver, what the care duties might look like. So what is included in the caregiving activities. With regard to the data collection, we hired the commercial company Qualtrics that collected data for us, because it's a huge data set and it's impossible to collect it by the center. So we hired the Qualtrics to collect data based on the predefined quotas and screening questions. Qualtrics considered based on our requirements and our budget our budget options, They suggested the number of respondents they are able to collect for us. The number is or was 4,353 respondents. And to reach this number, Qualtrics employed two methods for data collection. The first one, the easier one, was online survey using data panel data. This method is based on how many people and how many people live in the state and the population density, which works also for the mixed method. That was the second one. So Qualtrics, based on the population density and number of population in each state, decided to apply online survey in 9 of North Central regional states that are more populated, and collected around 417 households in each of these states. In 3 states that are less populated, Nebraska, North Dakota, and South Dakota, they implemented 2 methods. One was best effort online panel, and the second one is computer-assisted telephone interviewing, CATI, which is a time-demanding and expensive method. Therefore, we have less respondents in each of these states and have about 200 households or householders in the survey. So the final number of respondents, including the respondents from the soft launch, is 4,532. And out of this number, nearly half of them are caregivers, either just only child caregivers or adult caregivers or both. This is a little bit about how we defined rural areas. We asked respondents 2 questions. Where is your household located, and how would you describe your current residential location? In case of the first question, the rural areas are defined as open and sparsely populated countryside and towns with less than 2,500 inhabitants. The second question is used by Qualtrics to define what is rural and what is not rural. And as rural, the areas that are open or sparsely populated countryside are considered, or these areas are not within commuting distance to urban or suburban areas. This map showed distribution of respondents by state. You can see North Dakota, South Dakota, and Nebraska with lighter colors. The other states had more respondents and are colored with darker blue and brown color. As a reminder, I am showing now the distribution of all respondents, and Florence then will talk about caregivers and probably also their geographical distribution. Where you can find the data set. There are 2 ways how you can find the data set. This data set is for free and is publicly available, so you can easily reach to the data without any fees and without any restrictions to sign up and other difficulties. The easiest way is to go to Purdue University Research Repository and through a search, find the caregiving survey. This will bring you to the website on the left side, and you can download the entire bundle that includes a data set in Excel file and code book that in detail describes all questions that are included in the survey. The other way how you can reach the data set is through the website of North Central Regional Center for Rural Development. When you go to the website and click on the Community Development tab, you find the Caregiving survey, and the purple button on the bottom of the page will bring you again to the Purdue University research repository where you can download the data. And I will turn over to Florence. She will tell you more about the data that are related to caregivers in the caregiving survey.
Thanks so much, Susanna. And so what, as Susanna said, I will be presenting very high level findings. And as Shoshana mentioned when we started, this is to whet your appetite, and this is to show you what kind of questions we ask, but also for you to get a sense of get a general idea of who the caregivers in the North Central regions are, and how caregiving impacts people's lives. I'd like to give a quick thank you to Susanna and the whole team and NCR-CRD for all their work on the survey. When I downloaded the data set from the database and I started working on it, I couldn't help but see how clearly laid out everything was, and how it was very easy to work in the data set and looking at the code book. So lots of thank yous to you. But so let's look at the data. What did we find so far? So out of the 4,500 respondents, 52% had not provided care in the last 12 months. But as Shoshana opened with the quote of the former First Lady Carter, caregiving is something that is a universal experience, because when we asked folks who had not provided caregiving in the last 12 months, had they in the past, it was well over 60% of people, it was 58%, sorry, who said, yes, I have provided caregiver at some point before. So looking at the people who are currently doing caregiving, 39% cared for children, 26% cared for adults, and then 35 cared for both children and adults. And that's what sometimes you hear people refer to as the sandwich generation, who are not only caring for the children, but also adults, and the kinds of challenges that might present. So in terms of who's doing the caregiving, to give you a general idea, most frequently caregivers were female. They were on average 44 years old. They were white, 82% were white, followed by Hispanic or Latino, and then Black or African American. 60% reported that were salaried workers. And after that, the most common occupation that people reported was retired. I also want to say that we asked a question around, if people were self-employed as well as if they farm. So there are also opportunity to compare the findings based on the different types of occupations that people have. People had on average household income of $50,000 or higher. And then they lived in suburban areas, urban and rural areas. And in terms of the sample specification, what this means is it gives us a nice number of respondents in each of the categories in order to be able to do more in-depth comparison, for example, through bivariate analysis or multivariate analysis. So in terms of the reasons for caregiving, we had a number of questions that asked, why are you, what's the reason for caregiving? What might be the specific needs of people that you care for? And here I'll show the data both for separated for children and then adults. So we see that for children, most often time, the children did not have a health condition, versus for adults, somewhat as would be expected, adults had a specific condition, maybe short-term or long-term condition. When we look at what kind of conditions we're talking about for folks who reported that the people they care for have a short-term conditions, that was most likely to be a physical health condition, versus for a long-term condition, it was most likely to be connected to emotional, behavioral, or mental health condition, learning disability for children, or memory problems for adults. In terms of who is being cared for, we see, we look at for children, we see a split, not even across the age categories, but it's for adults where it is, where we see more differences, where up to the age of 65, about there are about a quarter of folks in each categories. And then the proportion of increases as people as people age. So we also asked what are the most frequent relationship to for both the children and the adults. And here we see that the importance of family, that there is a high proportion of people are caring for people in their family. And it'd be interesting too to see where, how does that vary based on the relationship? For example, how much time people spend doing caregiving, as we see that grandparents and uncles are involved in caring of the children, as well as similarly biological family for the adults. So we also were interested in understanding what are resources needed for caregiving. And we asked in terms of time, how much time are people spending doing caring for children versus for adults. And we see more of a split for children where 18% of respondents say that they provide constant care versus for adult, it was 8%. And also this is where it would be interesting, for example, to compare on based to who is the caregiver, right? Does the time spent doing caregiving varies if we're talking about parents versus grandparents or aunts and uncles? We also asked about about expenses for caregiving in both cases for children and adults. About a third responded that they're not paying for the caregiving. So that was a question asking, are you paying for the caregiving? And we also asked a question, are you financially compensated for the caregiving that you are providing? And so also we see too, so as much as there is a third about that does not pay, not either for children or adults, we see that there is about 30% of folks, both for caregiving of children and adults, who are spending more than $200 per week on caregiving. And so that brings up questions too, as Shoshana was talking about, what are the implications on household finances and on household strategy? So that gets us into the impact of caregiving. When we ask folks, how has caregiving impacted your employment, your education, your ability to do your household work? Here for changes to employment, we see that a third had said that yes, they had made changes to their employment. And most often time what they did is they cut down the hours or stopped working at their jobs. And then when we asked questions around how might that be impacting, how might caregiving be impacted finances, over half said that they had experienced financial difficulties. And out of those who experienced difficulties, we find that most often people had taken on more debts, they had stopped savings, they had missed or were late paying student loan. And so this brings up not only questions in terms of the short-term finances and the ability and people's ability to meet their needs, but that also brings up questions around consequences in the medium to long terms around what happens when people are taking on debts or they're no longer able to save, for example, for their retirement or for college of their children. And so those are questions that are worth asking, looking at more closely. I did some bivariate analysis. I wanted to see, well, how does the impact varies based for people who are only caring for children versus people who are caring for adults versus people who are caring for both children and adults. And in the case of these two particular questions, the greatest impact was for those in what we call the sandwich generation. So they're caring for both children and adults, and then followed by caring for adults. And so that brings up questions too around how does different type of caregiving impact finances, the cost of this caregiving, but also the extent to which folks might have had plans to do this caregiving versus not. We also wanted to understand how caregiving is affecting people's health and well-being. And we asked about how it impacts their physical health, mental, emotional health, and social life. We see in the middle category that when looking at folks who said they were not affected in any ways, that proportion was much higher for physical health. But then it appears that for mental, emotional health, and social life, it does impact about half of folks. And when we look how it's impacting folks, it is for a third of people, it's making their mental, emotional health and their social health made it worse. But for some folks, it's making their life better. So when we look at the variations in the impacts based on the type of caregiving and physical versus mental health, this is where also there wasn't a clear pattern, whereas there wasn't a clear pattern in terms of if you are caring for adults, you're most likely to report, that it has negatively impacted your mental or emotional health. So that requires further analysis. And then the last piece that I want to share today is about supporting caregivers, both in terms of what people are using currently, as well as what could help them in their caregiving and doing their caregiving. So when we asked a number of questions around social safety net programs that people might have used, as well as informal community support, almost 60% had said that, yes, they have used safety net programs. And most frequently what we found, and some of it might have to do because of the timing of the survey, where almost half reported COVID-19 stimulus check, and then about a third respectively had received food assistance or Medicaid. It's also interesting too how we often talk about the importance of communities to support people, and I was surprised to not see community support rising higher than what we found. And then when we ask people about what could help you, what type of information would you like, or what kind of help would you like, 62% of respondents at least selected one option. And we see a clustering around a third of people interested in the resources that I've listed here. And it's two types of resources. It's resources connected to helping people do the caregiving. So for example, more help with activities to do with the people that are cared for, keeping the people that are cared for safe, managing challenging behaviors that people are cared for. But it's also about resources for people directly doing the care. For example, receiving a financial compensation for doing the care, as well as managing emotional or physical stresses. And so there is a lot more in the survey, and I wanted to put also available showing the data set that could be of interest to folks. The further demographic characteristics of respondents, such as their marital status, their education attainment, household expenditures, state of residence, to be able to do geographical comparisons, spatial comparisons. We also have details on childcare and adult care arrangements, both formal and informal. So for example, we asked for the children, who is looking after the children during the day? Is it you as a parent? Do you have a family member help? Do you use home-based childcare, or do you use daycare? We also have a number of questions around the availability and satisfaction with childcare and adult care options in the community. Because one of the emphasis of the survey was on understanding the connection between caregiving as well as participation in the labor force, but also thinking about how do we support workforce attraction and retention. We asked questions around benefits provided by employer to support caregiving, both benefits that are currently offered as well as desired benefits. And last, we also asked about the types of caregiving supports that people are using, informal and formal, as well as would like to use. So that's what we had to share in terms of the finding, and I wanted to bring that back to the slide that Susanna had showed to show you where you can access the data. And I think we have time for questions and comments.
Yes, definitely. Please feel free to put questions in the chat. You can always also raise your hand if you would like. I think we have plenty of time for some questions, comments as well. I think I don't know if you all want me to monitor the chat, but there's a question that says, can you share your share the PowerPoint with the webinar participants? Yes, we usually put the slides with our webinar. You'll find it on our YouTube channel, but you'll also can get it when we send you the link as well after the webinar.
There's a question about geographical distance as part of the survey set. Wait, I guess I'm not entirely sure. Katie, would you mind maybe unmuting and asking what you're thinking about in terms of geographical distance?
Yeah, distance from the care recipient to the caregiver.
Yes, we did include that. I think we did it by hours, right? Is that what we did? Minutes and.
I will check it in the code book, but we definitely had this question in the adult caregiving section where we ask how far, no, how long. Yes, yes, we ask where do the adults you are caring for live? And we have 7 options: in my household or home. The second option is within 20 minutes of my house, then 20 minutes to 1 hour, 1 hour to 2 hours, 2 hours to 5 hours, 5 hours to 10 hours, and more than 10 hours. So it's not in miles, but it's in hours.
And the reason that I think we intentionally did that by minutes and time is because, especially if you live in a dense urban area, it can take you, an hour maybe to get across town, and it can take, even if it's only going like 4 miles, right? So that's one of the reasons why we wanted to understand that and get to some of the folks' transportation issues.
I think somebody also asked about next steps.
Yeah. Florence, do you want to take next steps?
Sure, I can start, and then Shoshana, you and Susanna can fill in. So what we're going to do now is we're going to develop a series of research briefs that will highlight subsections of the surveys to provide high-level descriptive statistics. So for example, there'll be one research briefs that will have what I presented today. And then there will also be research briefs that we will do to compare across states. But then some of us are interested in developing, doing more in-depth analysis, and we've started to talk about what are the research questions going to be. But this is, I think, what's exciting about this data set is that it is available for people to use and develop their own questions based on their interest. Shoshana, anything you want to add to this?
Yeah, no, and I think it's again, it's also not just for research, but also really for folks that are in the nonprofit sector who are working within extension, for you to create information, whether it's for decision makers, policy makers, getting baseline assessments. So there's a really wide utility, and I'm not sure, if Susanna Maria, if you want to share at all how you might like to keep in touch, if you'd like folks to share what they're doing with the NCR-CRD, or not. Yeah.
We always want to hear what they're doing at the NCRC, at the NCR-Stat. One of the reasons we do have it open access and in the research repository is if you do use it, please cite the data, and that citation is there for you, because then we can keep track of how much this is used and what are you using for. And for us at the center, success means that you are using the data set in some shape or form, whether it's to do tables and charts to motivate why a certain topic is important, right? So that's also a reason for an extension program, or like they said, C data. So there is a citation there, please use it, but we would always welcome you letting us know, hey, we use the data and we're just doing a conference presentation, and this is how we've used it.
Yeah, and just to follow up, Susanna, Susanna, there's a question about, should we collaborate with you if you're interested in further research? I think, I don't think any of us that helped develop this data set feel like complete ownership over it, right? And so if you're interested in exploring collaboration, I think you were always happy to talk, but I don't think that that's at all a precursor to that in any shape or form.
I would say if you have questions about the data or particular variables, we're usually very happy to help you in terms of, like, if you're like, yeah, I'm looking at data and I'm wondering about this, please shoot us an email.
Yeah, I can attest. Susanna is speedy in her response.
We have here one comment. I work closely with the Alzheimer Association, providing programs for financial wellness for caregivers and their families. This is one of the most popular programs in my experience. Financial institutions are always happy to attend professional development. 6 million individuals across the nation suffer from some form of dementia, so this is an important topic. Thank you for that. We are happy that you find this survey and the results interesting. And yes, I think that all was said about the further steps. I do not have anything to add. It was completely exhausting answers. So yeah, there is a lot of what we can do with these surveys and the data we got.
Susanna, do you want to answer this one? There's a question, how did you come up with the rural or small town description?
This is the definition that is provided by ERS, USDA ERS Economic Research Services. Is that correct? I think yes. So they use this definition for rural areas. Basically, rural areas are all areas that are not considered as urban. So this is something that is not considered as urban, which then can be considered as rural. Open and sparsely populated countryside and towns with less than 2,500 inhabitants.
Susanna, there were two questions about geographical location, and I don't know if there was the one where we asked people to self-describe, and then there was the one, so do you live in urban, suburban, rural, and then there was the one based on how many people are in your area.
Yes, there are two questions. One is specifically about the location in terms of the number of inhabitants. This is based on US Census Bureau and ERS definition. The other definition, urban, suburban, and rural, is the definition provided by Qualtrics company that corresponds with US Census Bureau as well. And it's more descriptive and more related to the description of the respondents, how they think their place of living should be specified. So rural, suburban, or urban, not based on the number of population in the area, but it's more descriptive.
Well, one thing I didn't mention when I was talking through the findings is that what I think it's the importance of looking at the variations in lived realities of folks, because when I was looking across how, whether you're only caring for children, only for adults, or both, what I looked at, pretty much all of them were statistically significant and a p-value of 0. And so I didn't dig further for this particular presentation today, but to me, it really tells me that, we can't, it's not a universal experience, right? And there are opportunities for folks with a data set to really look at how these experiences are vary, not only based on who you care for, but also what area do you live in, what kind of amenities might be around in your area, even how you perceive, how the respondents perceives those amenities.
More questions?
And as Shoshana mentioned, this survey was also applied in Northeast region, which is great because now we can not only compare data on the state level, but also on the regional level between two big regions, North Central region and Northeast region. The survey is the same with the same questions. The quotas are a little bit different. Otherwise, even the size sample is very similar. And now we are at this stage when we're finalizing the data collection. We will continue with data cleaning and processing, and data will be available probably late spring, again on Purdue University Research Repository. So altogether, there will be about 9,000 respondents from 2 regions. And now, at this moment, I already know that, again, around half of the respondents in Northeast region are caregivers. So we will have about 5,000 caregivers from both regions.
Thanks again for the
Which is
reminder, Susanna. Well, with that, if there's no more questions, we will close up. Remember our webinar, next webinar is on droughts. We have a plethora of different topics in March. You will get a link with the webinar recording and the PowerPoint presentation. Thank you so much for joining us, and thank you, Shoshana, Susanna, and Florence for that great webinar and for doing all the work for the survey, putting the survey together. And then if you probably ever heard me, I'd say we have beautiful code books, so it makes it very easy for you to use the data. So please go out, use the caregiving data set. Thank you so much, everyone.